Namaskar, welcome Wide Angle with Ashok Vyas, and today I am delighted to be welcoming Dr. Raval. And Dr. Raval is related to a very specialized field which is neuro-oncology, and he is also a candidate for the upcoming AAPI election contesting for treasurer. But presence of such dedicated physicians is like a treasure for the society. So let me take the opportunity of welcoming Dr. Sumul Raval. Namaste. Welcome.
Thank you.
So, Dr. Saab, the way we begin with our dreams is always fascinating for others to learn about your pathway. So, becoming a doctor, was it something you picked up from somebody in the family? How you chose to follow this path?
Well, it's so funny you say that, because when I was in 4th grade, in our school notebook, I wrote that I want to become a big doctor when I grow up.
Wow.
After all my medical education and after becoming a neuro-oncologist, when I went to India once and I visited my back home, my lower school teacher, fortunately, had kept that book. And she showed me that book and said, Sumul, do you remember you wrote this in the 4th grade? So that was always in my mind, that I want to become a doctor one day. And kind of doctor that people will go and there will be no further opinion after that. So that was my dream, that I would become something that I would be contributing to people and their life.
So you wanted to become a source of knowledge which would serve people, help them, and that you became. And neuro-oncology is such a field that many people don't even know about what is it that neuro-oncology means. So let us begin by learning what is it, because oncology, that cancer, then neuro combined.
So let me just track back a little bit. I went to medical school in MP Shah Medical College in Jamnagar. After graduating from medical school, I came to United States. And then I started working as a neuroimmunology fellow in UMD-NJ, now called Rutgers University, New Jersey Medical School, where I did later on my neurology residency. After finishing my neurology residency and neuroimmunology fellowship, I went to Sloan Kettering to do my neuro-oncology fellowship. After finishing the neuro-oncology fellowship, I worked at Sloan Kettering as a neuro-oncologist. And when I was working at Sloan, I used to see patients coming to Sloan, traveling, taking so much trouble. Sometimes very senior elderly people, sometimes their family members have to take a day off to bring them to the Sloan. So at that time, and I used to live in New Jersey, only dream that I had was to set up New Jersey's first brain tumor center, where people like those patients don't have to travel to get the cutting edge care. They could get that best care in their backyard. And with that mind, that dream that I had, I came to New Jersey and I started practicing in Monmouth and Ocean County as a neuro-oncologist. Fortunately, within the first year of my coming, we were able to start New Jersey's first and most comprehensive brain tumor center in Monmouth County, in Monmouth Medical Center.
That is so wonderful and incredible. As a member of Indian American community, we feel proud of the way with such specialized fields you are a known name. Let me now backtrack with your permission, and when you do your internship at a place like Rutgers and coming from India, and you have an additional, call it a pressure or need to prove yourself. One, you are learning about the new system. So talk to me a little bit about comparing the way you were being trained in India, and what was the major difference, and was there any additional challenge that you faced in order to fit in coming from India as an immigrant?
I think that was a very good question, because we always have, we have a different system, medical system there. We have a different exam system as well. So coming off them, actually we had a more intense system there for the examination, and clinical part was also so intense that we used to see there was no limit how many people or patients you can see in one day. So we were trained actually much better ways there. The only difficulties in the very early beginning we had was a bit language issues. We come from completely different language culture issue, and eventually when you start doing it, you become used to with those things. So then with your motivation, your hard work, and your background of doing so much clinical work, it takes you to the next level very faster.
Talking about next level, and because we are talking about India and America together, sometimes when you have scarcity, that brings out your creativity, and you figure out innovative ways to make things happen, which in India बोलचाल की भाषा में जैसे जुगाड़ कर लेते हैं. But that kind of continues in terms of our focus on using minimum to give maximum output. Whereas sometimes in American system, the abundance of resources may also come to your help. So talk to me about what makes America a great place of learning. Is it just resources, or people are motivated, and the role models that you had while you were doing your residency or internship here at two places?
Right, so I think that's also a very interesting point you brought up, because even today, as you said about the differences, even today, when I graduated from Sloan Kettering, there was no neuro-oncologist practicing in India at that time. And I used to go there, I used to see people from India come here. And even now, the field is so limited. There are not many neuro-oncologists just practicing as a neuro-oncologist. The technology, it is so much different here. I think we had caught up with this technology there as well. Now in oncology, it's more so much that now we follow the guidelines. So everywhere we're getting the treatment almost same with what we call NCCN guideline, National Cancer Guideline, where everybody has to follow the similar kind of treatment protocol. So I think that caught up with the time and technology, but of course with the resources that we have a lot more here, we were able to provide with more advanced care to even a very ordinary person. You don't have to be VIP to get the VIP treatment here.
So you become VIP by coming to America is not what we are saying, but sometimes because the kind of lifestyle which you can lead with minimum wage here, we cannot dream about that sometimes if we are in a different country. But now looking at your passion, and you felt the need to establish or the desire to establish something related to brain tumor, right?
Right.
So how that came about, and what has been the most satisfying aspect of your functioning here in New Jersey in the field that you wanted to be in?
So that is also a very good question, because a lot of good things happen in last 20 years in a field of neuro-oncology. So as I mentioned earlier, neurology is a field of diagnostic medicine. A lot of time we diagnose and there are not many cure to the disease, so we just treat them. I always tell them we have a treatable problem, not a curable problem. So I wanted to get more aggressive in a field of neurology, more aggressive interventions, and that's why I chose to become a neuro-oncologist, where I can make significant contribution to people, their life. I wanted people extend their whatever quality of life I can. So with that in my mind, and with our brain tumor center that we started in 2006, and before even my brain tumor center was started in 2004, actually, there was some, I would always call, magic happen in my life and my career, where I started one chemotherapy combination for most malignant brain tumor called glioblastoma, and that patient that came to see me was told by a lot of famous physicians and high-power neuro-oncologists from a country that he will not survive for a long time with the disease he has. when they came to see me with all entire family, 11 people in my exam room, I told them that I have something in my mind. I'm going to try. If you guys all agree, you have a serious problem, and we all agree and accept because you were seen by all this many famous people. But if you allow me to, I want to try this new regimen. And they all agreed to do that. And I gave them a chemo cocktail. And then 2 weeks later, I gave them second dose. And then 1 month later, I did the MRI of the brain. And fortunately, 100% of that person's brain tumor disappeared from his brain. Nothing like that ever happened in neuro-oncology world. And I was literally, I actually checked myself 10 times just to make sure that was the right patient MRI I was looking at. And then I started dancing myself, and nobody had any idea why I was dancing at that time. And then family, then I broke the news to family that we have something magical happen, and your tumor is gone in your brain. And that led to another patient, and that led to another patient. And then when I published that series of first page, 17 patients, I had 100% response rate on that chemo regimen in brain tumor. And that was the most malignant brain tumor called glioblastoma. And we published that first paper in Society for Neuro-Oncology. And then later on, I published continued the same chemo regimen. And we had given few more patients at that time, and the second paper was published in Society for Clinical Oncology ASCO annual meeting. But there was tens of thousands of people came to visit our paper, and that made kind of historic contribution in literature, because that was the first drug that United States FDA approved for the recurrent glioblastoma. I'm very proud to say that at that time we were the second highest patient that was published in a country from our practice.
I'm so delighted, and as you mentioned, you were dancing, and I was dancing without visibly seen as dancing, because it's such a source of joy. One, you could come up with something that could save somebody's life. It's such an important side to our life, and at the same time, you could also come up with a method or a discovery which further help more people and is going to help more people. So what was the overall mood among your peers or in the hospital, and where did it created some additional steps for you to move forward in the direction of discovering something new?
So I think, so when I was dancing in a hospital looking at that MRI, our hospital CEO was making round in a hospital, and then he saw me and he said, "Dr. Raval, what's going on? You sound so happy." And I told him that, "Steve, remember my words, this is going to make a headline news on every news channel, front page newspaper." Of course it did. It came on a evening news, it came on a front page on a newspaper, that experimental treatment shrinking brain tumor. And with that much information, it spread like a wildfire. We were the very few people in a country using that regimen at that time. We were started to getting people from all over the United States. We had a patient came from all over the country and all over the world for this treatment to our center. So that made a big impact on contribution to people's life at that time.
Wonderful. So now someone like Dr. Sumul Raval, who is so passionate and dedicated and has written so many research papers, how you find time to get engaged, involved with organizations like AAPI? And what is it about AAPI that you feel is significant to strengthen it?
I think so. AAPI is the second largest ethnic medical organization in our country after AMA. Our founding godfather, what I call for AAPI, had a vision to make AAPI as a big organization where we can contribute not only to medical field but policies, healthcare, charities, research, all different ways that, and I feel that if we use the resources that we have in AAPI, we can do a lot more than we are able to do at present time.
So I just take this pause to connect your thought pattern on, you have some idea as to what can be done through AAPI or what you would like to be doing as an official serving AAPI. So what is it that you think is still pending in addition to what AAPI has done?
So I think there are so many important things, issues that we have right now that we can contribute. As I said earlier, being a second largest ethnic medical organization, we can change, we can work with our federal government, we can help them decide the healthcare policies, we can combining with the AMA and other medical organizations to create something that will create like a new standard for different fields of medicine. Uniting with different medical organizations, we can also provide research, we are provide the platform for education, we are providing platform for charity to different levels. As for example, even at our own AAPI, when we had second COVID wave during the Delta variant in India, AAPI had collectively from entire country collected more than $5 million and had provided so much oxygen concentrators and so many other medical equipments to the India at the needy places. So there are so many different things that we can do as an organization if we work in a united way.
If is always interesting. If we work in a united way, one would say the same for the nation also. But continuing with what you just mentioned, that tells me the need to become more aware about how the political system functions and how policies are framed, so you interact, explain, and have a continuous communication with policymakers. So if I may suggest, and like you have CME in most of the AAPI events, that is continuing medical education. Probably you should consider having something like CPE, that is continuous political education. When I say political education, I mean you need some dedicated group of people from AAPI who would make liaison with politicians and political representatives, and I think it is a very specialized ball game in America. Like you have lobbyists from different countries, so probably
right.
You need. What do you think about so far the communication with White House from National AAPI?
Well, I think you mentioned that so correctly, because I am a legislative chair for our AAPI at present time of the National AAPI. So being a chair of a legislative committee, my role is to have a one big legislative day. Normally we do it in Washington DC once a year in early or some part of the spring, where we invite a lot of lawmakers from Washington DC and have a bigger event. Because of the pandemic this year, we started doing program called Latte with Legislator. So we started doing it last several months. We invite different legislator, US congressmen, US senators, and I just wrote a letter to our vice president and president of the United States as well to be part of our legislative talk, where we are discussing different healthcare related issues. What can they do to help us or help them decide different policy, health reform, healthcare reforms, and it's going very, very well. We're doing it at every second and fourth Sunday with different legislator, and it's a nationwide program at being also recorded on Facebook Live as well, and doctors from AAPI doctors from entire country able to participate in that.
And that's very good, very, very encouraging. You are on the point, and many organizations are good organizations, but they don't have the second generation taking active interest in the activities of the organization. I think AAPI is an exception, because young doctors are also active in AAPI as far as I think. What is your thinking about how to make young Indian American doctors more active in AAPI?
I think that is one of my biggest goal, to bring younger generation physician, Indian origin physicians to AAPI platform, because those are the key people who's going to do a lot of good things in the future. And I always tell our senior advisors and senior AAPI leaders that do whatever we can. Let's make this new generation active. Let's help them come to the AAPI in whatever capacity that they can, so they can start contributing to their field, whatever field they are in for the AAPI.
Wonderful. And now you are contesting for the position of treasurer. What is it that you feel would be your role as treasurer, and what is your inner satisfaction in looking at yourself serving AAPI in this position?
Well, I think treasurer is, as my father used to say, 1,000-mile journey start with the first step. Is the first step to get involved into, and one of my other good friend, Congressman Raja Krishnamurthy, always will say that if you're not on a table, you will be on a menu. So I started thinking that way. He said, if you don't participate in actively into organization, then you're not going to take it to the next level. So I have a lot of plans in my mind about what I'm going to do in the next few years. As a treasurer, I think my role is to keep the finances as a transparent. I want to make sure that we remain united. We continue to grow more, both financially and academically. We also want to do a lot of charity and research, and I want to participate in all those activities as treasurer. And starting as a treasurer, my of course goal is to eventually become a president of the organization at one time.
So we will definitely be talking to you as president of AAPI in coming years. Which year I don't know as yet, but as we speak post-COVID, how do you feel? Should we still be cautious in mingling with each other?
I think it is still a good idea to stay cautious. The pandemic has improved significantly in every level, but at the same time, it is not over yet. So we still want to be extra careful, take the vaccines, take the boosters, and use the mask where required to be.
So 2 questions as we conclude. One, who is your role model? And second question, any other significant moment in the course of your profession which has been a source of satisfaction or joy, as you mentioned about that innovative approach to have treated this patient?
So my role model, 2 actually role models that I had when I was doing my neurology. I had Dr. Peter Dowling, who helped me to become who I am right now, and Dr. Stuart Cook. Dr. Cook was the chairman, Peter Dowling was the vice chair, and I worked in Dr. Dowling's lab as a research fellow at that time. And then at the Sloan Kettering, Dr. Jerry Posner, what I call as the godfather of neuro-oncology, where he introduced neuro-oncology field to United States, and Lisa DeAngelis, who was my chairman at that time.
Wonderful. So we appreciate you having taken time to join us here at ITV studio. We wish you the very best, and on behalf of ITV Gold and our chairman Padma Shri Dr. Sudhir Parikh, as I wish you good luck. Any additional thoughts about the role which media or ITV Gold can play with AAPI to serve the community?
I think we started doing the talk with the ITV Gold. Padma Shri Sudhir Bhai had agreed to do the show where medical education will be provided by different specialists in different timing. So I think it is coming up soon. So that will be very interesting subject and interesting topic to hear from different specialists.
Wonderful. So Healthy You and AAPI will be a new series very soon on ITV Gold with AAPI. So thank you very much. Lots of good wishes.
Thank you so much. Thank you so much for having me.
Thanking Dr. Raval and thanking all of you for being a part of this conversation with lots of good wishes. This is Ashok Vyas.
Thank you.
Namaste.